So in this video, I'm going to address some of your common questions about nursing school. What is it like? What if you fail a test? What if you miss days? Things of that nature. And if you have any other questions, please leave it down below and I will answer it in another future video. But let's get started. So, nursing school it's a lot. It's a lot of material to take in over the course of 2 years. 2 years if you're an associate's degree program, and 4 years if you're a bachelor's degree program. But the thing is, they're about the same. Associate's degree program does not include the general requirements that you will have to fulfill in the previous 2 years before you get admitted to the nursing degree program. So technically they're both 4 years if you want to count prerequisites for an associate's program. But for an associate's program, and I'm only going to speak on this, you are expected to learn a lot of information in a short amount of time. Before you know it, in the next week, you will be having a test on cardiac, on respiratory, on the fundamentals of nursing. First off, it will always be the fundamentals of nursing. So in the first semester, they're going to teach you the fundamentals of nursing. They're going to teach you how to be hygienic, how to not spread infections, how to not spread bacteria and viruses in the hospital, washing your hands thoroughly, sanitizing in and out of the room, or washing your hands in and out of the room. So the basic function or the basic focus of being a great nurse is to make sure you don't spread infection and that you are able to notice when a patient is declining or orders are wrong. These are all things that you will learn. But in nursing school, you will have your tests. They may be tests given by a certain organization like Kaplan. So they will require you to buy a subscription to Kaplan so that you can access these types of tests that will happen probably once, twice, 3 times during a semester in your nursing program. And your nursing program will use these tests to kind of gauge what it is that where you're at as a nurse, as your knowledge, your student nursing knowledge. And a lot of people feel that they fail these tests, but in my nursing program at least, these mattered not very much. What mattered was the actual tests that the school was giving you, or the course or the program was giving you, but not the Kaplan tests. It was just a way to gauge what you needed to study before you hit the NCLEX. In their perspective is what they said. So you may discover that your scores will be very low on those tests. And it's supposed to mimic the NCLEX that you will take when you go to get your license at the end of the program. So you will have those on probably a quarterly basis, or however many times your program decides that you should have those. You will also have lecture days, twice a week for us, and then twice a week for clinical rotations. So you will be assigned to a hospital to go for your clinicals. For us, our clinicals were from 6:30 in the morning to 2:30 in the afternoon, with an hour lunchtime and 15-minute break. So we would follow an assigned nurse. Well, actually, we weren't assigned to a nurse. We were assigned to a room number and that specific patient. But whomever that nurse was, we would be with them at that time and make sure that the care was being covered, the orders were being looked at, assist that nurse in whatever we could assist with, being unlicensed personnel. So basically, we would do the work of a CNA at the very least. And at times, your nurse will guide you on doing certain procedures. If they're inserting a catheter, that's a good skill to learn. If a patient needs an IV inserted, that's a good skill to learn as well. Clinical rotations may be assigned to you as far as a hospital, or you will be able to pick the hospital yourselves. In my situation, they let us pick the hospital, and I would, and you would normally pick the hospital that's closest to you or most convenient for you. And there's a specific professor or clinical instructor that is assigned to that hospital, so they will be your instructor there, or you will be assigned to an instructor if that hospital is pretty big. So, which means that there will be more than one instructor at that hospital. So it would be 6:30 to 2:30, and you will be starting with the day shift when they come in at around 7 or 7:30, and get report with your nurse and start your day and get to see what it's like to be a nurse on that floor. Taking vitals, most of the time they will ask you to take those vitals. First semester, fundamentals of nursing. Second semester, you dig a little deeper into something else. For me, it was labor and delivery, with the first half of the semester being med-surg. And then labor and delivery and postpartum care. And then you will also get some rotations to go to another floor. So you might be assigned with a partner to go to the OR today. So you're going to get to see some surgeries. You might be assigned with a partner to go see what case management does, or follow the wound care nurse who will go to different floors. Things of that nature. And then third semester for us, first half of the semester was med-surg. Again, developing more of your med-surg or your basic skills as a nurse, inserting IVs, wound care, diabetic care, chronic lung disease care, those types of things that you will see on a med-surg floor. And the second half, we had psychiatric rotation. So we would go to a psychiatric facility and get assigned to instructor there as a group. Each of your clinical rotations will be with a group, whomever picked that specific site. So you will all have a group and become familiar with yourselves, or become familiar with each other. And in each clinical rotation, you may have some type of presentation due at the end of the semester, which you'll have to present to that small group. You might, cover a certain disease, or maybe it'll get assigned to you, or something of that nature. Small project of some sort. And then in the fourth semester, it was just basically all downhill and easy from there. So for us, it was med-surg. So now you're a little bit more of a pro in all your skills. Supposedly, you'll still probably get assigned to another floor, to follow a nurse for that day. You might go to ICU, you might go to the ED, things like that. Again, there's another project. And the other thing that happens during the whole nursing school semesters is you will have specific sim days, simulation lab days. So everybody in the whole cohort will come to school on that day, and you will be dressed in your uniform, and you will be going to the sim lab, and you will rotate between certain sim labs or different scenarios. You might learn skills that whole day, and then later on in that day you will go and you will have a small group and you will go into the sim lab. Your nurse instructor will give you instructions on what's about to happen. You might, for that day, have a patient that has a heart condition or has a COPD exacerbation. So things that you might have already studied before. And they will tell you what's going to happen, and then you will embark on the actual sim lab scenario. So you will come in with your small group. He or she will S-bar you, give you the situation, the background, the assessment, the recommendation, all of the details that are pertinent to what's about to happen or what situation you're about to walk into. Then you'll walk into the patient's room, introduce yourself, make sure you wash your hands, or use the hand sanitizer to make sure that you're following the rules of what you're supposed to be doing. And you're basically the nurse. Ask how they're feeling. Usually the dummy or the sim lab dummy will be moaning like a patient, and you'll have to assess them and figure out what's wrong with them, look at the orders and see what's appropriate to give to that patient to help them, or you know, call a doctor, whatever it is that you think you should be doing. Meanwhile, the instructors are back in another room and they're listening to everything that's going on, most likely speaking through the patient if you have a high-tech lab at your school. And the vitals will be, you know, running like this is a real patient, and it'll start escalating. The heart rate will go up, things will start beeping and going crazy, and you need to figure out what it is that you need to do. Not just you alone, but your team. Now, this might sound like an anxious type of situation, but really, it's a learning experience. They don't expect you to get this right. And in hindsight, that's what I know now. But in the moment, I had no idea. I thought we had to get this right. And I was like, we're all freaking out, you know. But afterwards, because I think you get like 5 minutes in our scenarios at least, you go and you debrief and you kind of figure out what you did wrong, what you did right. And the instructor kind of guides you in these conversations. You know, it's not I'm sure they were laughing back there at some of the issues that happened, or some of the moments that we had in our sim scenario. But when you debrief, it's less stressful because, you know, they make you feel reassured that this was just for learning. You're not actually getting graded on this. So, so it's more of a comforting environment to take in what it is that you don't know and what you should have done, what you could have done better, and what you can do next time and what you did well. So, yeah, it's to help you get real life experience in a stimulated environment. So you will have those sim labs throughout your semesters as well. You will obviously have your tests, and if you fail your test, most programs give you some leeway. They will have you retake the test at a later time specified by the instructor, and you will take that test probably in their office or at some site alone, in a classroom, I mean, not at a site, at a specific time during a week or a Friday, and your goal is to pass that test. Now, they might say that you have to miss less questions or something like that, but just read up on your specific school's policy. I did fail an exam one time, and that was like my first exam in nursing school, because it is true, the answer you think is right, but then also these other things are right, so you have to pick the best right one. So I mean, the one that is most right. So it can be kind of confusing and hard to get used to. So that first exam I failed, took the second one and I passed. So some schools have a specific policy for how many tests you can actually fail, and some don't, as long as you pass the second one. But the tests take some getting used to. And then as far as attendance, your school may also have a policy on attendance. So they might say you cannot miss more than 3 classes per semester. And that may apply to lectures and clinicals, or it may only apply to clinicals. Definitely do your best to show up to all the clinicals, because they're looking at you on that. Being professional, being in the right attire, being early, be early, and at the very least be on time. So, and try to get as much skills, and this is your opportunity to try to get as much skills in and practical usage, hands-on application of those skills as you can. Some training days in conjunction with SimLab to help you gain some knowledge on the procedures. So with dummies, we learned how to insert catheters, urinary catheters. With dummies, we learned how to put on an ostomy bag. With dummies, we learned how to find a vein to insert your IVs. So yeah. Also, in second semester, I forgot, the first half was actually pediatrics. So we were on a pediatric floor. We learned more about medical dosage calculations, which you really will need, which is the bread and butter right there. You really need to know your dosage calculations, especially when you really need to know your dosage calculations when dealing with adults and pediatrics patients, so that you do not kill someone. Medication administration your rights for medication administration is very important, that you will need to know and will be drilled into you so that you don't give the wrong patient the medication, the wrong dosage, all of the things. I won't go too into it, but you need to know your rights of that, and you will learn that. So that's basically what it's like in nursing school. It's a very broad overview, but I've touched on the important points. I've touched on the important points in nursing school, and if you have any more in-depth questions or fears that you have about nursing school, please do drop them down below and let me know, and I will answer them for you. Anyway, hope this helps ease your fears or helps you to make a decision on whether or not you want to pursue this career a little bit more or go into nursing school. If you'd like to know more about some of the specialties you will encounter as a nurse, watch this video here. Otherwise, thank you for watching, and I'll see you in the next one. Bye.